Hi, beautiful mamas. Welcome back to the Balanced Mama Project Radio. I am one of your hosts, Dr. Valerie Rucker-Bussie, and I'm here with Dr. Saiah.
Hey everyone, I'm glad you're back. Excited to chit chat today. We have a juicy topic,
Oh,
per usual.
yes. Let's
Per
get into
usual.
it. We're gonna be going into talking about pain with sex. So it's something that we don't often talk about. But it's important to talk about. And so we're going to define it. What is it? What's the medical term, just in case you ever come across it? What does it mean, pain with sex? What are people feeling? Sometimes um, we'll have clients who will say, I have a sensation with sex. And so we'll dive into what different sensations people might be experiencing. Everyone experiences pain in different ways. We'll also talk about what you can do because sometimes individuals think that they have to have this discomfort or pain,
Mm-hmm.
and that's not the case either. So, we will go into talking about what it is and how we can correct it.
Yes, thanks for the overview, Dr. Val. Quick background, if you've been hanging with us throughout the time here, you know we are both pelvic PTs. Dr. Val is a neuro and pelvic PT. But I do like to tell folks, so yes, the pain with sex, also known as dyspareunia, if you hear this come up in the clinical setting and somebody's like, dyspareunia, whether it's superficial, deep dyspareunia, it's just talking about where people are typically feeling the pain. But that is a term just for pain with sex. Yes, we're focusing on when it's coming up in the postpartum time period, but I do like to tell my ladies that this can also come up prior to having children. It can come up in menopause. There are various time periods in life when this can come up as a concern. So I don't want you to say, oh, I haven't had kids, so this should never come up, because no, it's definitely a thing. Or, oh, I've had kids, I didn't have issues immediately postpartum. It's never going to happen. I mean, I always hope it never happens, but just knowing that there are different time periods in life that can make it a little bit more likely. Um, and then time periods where it's a little bit less likely. And so today's highlight is postpartum time period. And that way you'll know if dyspareunia comes up, it's pain with sex. And also, if it comes up in postpartum, it does not have to be as scary. We're going to talk a little bit about why it can come up, and then we'll talk more about how to manage.
Absolutely. So there are a few reasons why it can come up. Some have to do with just physical changes in the body in postpartum, and then some have to do with emotional, regulatory, nervous system type of changes in the postpartum period. Some can be interpersonal reasons as well. So let's get into talking about it. Okay, Dr. Saya, let's talk about the physical factors. So
Oh,
some
yeah.
some of the aspects can just be like vaginal dryness. Now let's talk about why there might be vaginal dryness. Some of you may or may not know that there are some hormones that are shifting in postpartum period, and particularly we want to think about or we're going to talk about estrogen and what happens during the postpartum period with estrogen. So, you have this significant drop in estrogen that can happen in at any particular time during postpartum period. Now, we'll get a little bit specific because there are some mamas who are going to be breastfeeding, some mamas who are going to be using formula or other methods, pumping to feed baby, and that decision is going to determine when that estrogen drop hits. But the outcome of the estrogen drop is the vaginal dryness. So we'll talk a little bit more about that as well. Dr. Saya, feel free to chime in as well.
Oh, yes, yes. I'm glad you brought up the hormones. So it's interesting because that postpartum time period is almost, or is, can be very similar to the menopausal time period. Because,
Mhm.
yes, we're getting our estrogen drop in menopause, Also in that postpartum time period, it's like, yes, you get a rush of hormones when it's time to have baby, and you have the hormones increasing, estrogen increasing, all of these things flowing throughout the pregnancy. We get a burst when we're birthing tiny one, and then hormones drop off. Something that makes the hormones kind of stay, or not stay, but we'll say
Be a
estrogen
little more
levels typically,
plateaued.
yeah, stay at a lower plateau when we talk about lactating. So the same things that are helping us produce milk in that postpartum time period are also keeping those estrogen and progesterone levels lower. And so, with this being said, and with those estrogen levels being low, that is when we see things like Dr. Valerie mentioned, vaginal dryness, and even like the tissue elasticity in the vagina and in the vulva region. So, that's all that area right outside the vagina. Those areas, you might not be looking down there all the time, but they may not be as plump in that time period. They might be a little bit more dry, might not feel as stretchy or as elastic, whether you're feeling aroused or not feeling aroused.
Mhm.
And typically during that breastfeeding timeline, we can expect those levels to remain low. There's a lot going on hormonally, and even when people get into talks about when periods come back, when they don't, which is not the topic of convo for today, but it is something I like moms to be aware of. Like, hey, even we're looking at 8 weeks out, 12 weeks out, just because you get the 6 week clearance, yes, you can go back and be active. It does
Yeah.
not mean all of the tissues are in their like most lubricated state and ready for stretching.
And I want to
Um,
also mention too with the vaginal dryness. So as we're honing in on why that vaginal dryness would create that pain alarm or that pain sensation,
mhm.
I invite people to think about your skin in the wintertime, for example, when it's really cold
Mm.
and dry outside. Think about your skin. Even let's relate it back to your nose. So your nose is used to being lubricated in some way. You've got mucus in your
Oh yeah.
nostrils that help you, to breathe and smell and all those things. But when it's dry outside in the wintertime, sometimes people might get a nosebleed or something like that. Something adverse
Mm.
might happen, right? And that's because there's dryness in the air, there's dryness in your nostrils in a place that is used to having some moisture, and so that can like burst a blood vessel causing a nosebleed. And kind of also very similarly, you think about like your skin in the winter time, you
Mm.
might really reach for that like really heavy cream lotion to help to lubricate your skin so that you don't feel any discomfort against your clothing or something like that. So similarly to that, as since there's that estrogen drop, and we talked about there being various times where that might occur in postpartum, but the reason that that brings on that pain alarm is because that's an area of your body that is used to being lubricated, and that lubrication can help for, let's say, penetrative intercourse, penetrative sex. And if that lubrication is just not there, it's going to be uncomfortable. It's going to be a little, you know,
Frictiony.
painful, frictiony,
Bernie.
frictiony,
Yeah.
burning. So it might bring on that pain alarm. So I want to correlate those things, as to why vaginal dryness would relate to or could relate to some pain.
Dr. Val, you better say that. When you said the nose dryness in the winter, every winter I get multiple nosebleeds. Not that we
Yes.
all need to know, but I was
Mm.
like, it's a terrible feeling. Just that baseline, even being like, oh, it feels dry and nothing is rubbing them. Um, to your point of the lotion, there are vaginal moisturizers that you can use. No, it is not the same as the lubricant that you use right before, you may or may not use right before sexual activity.
Mhm.
Um, I tell people the vaginal moisturizers, of course, you can talk with OB-GYN about them. You can talk with primary care about them. They have some that you can get over the counter, but they act as lotion for the vaginal canal. And so I don't really Vaseline my nostrils. I'm not going to say that. but at least to kind of lotion, we'll say lotion the vagina or keep it lubricated until it starts creating its own lubrication. That is something to be considered. So if you are getting that frictiony feeling, if you are getting that burny feeling, sometimes people say, "Oh, it happened once and it's gone." I'm like,
Mhm.
"You go."
Mm.
But then if it's a persistent thing, that can be a chat with the doc on, hey, what type of moisturizers, if they have moisturizer recommendations, do you recommend? Or what are my extra options to keep the tissues lubricated?
Mhm.
So we've covered a little bit about the dryness. I also know that sometimes there is some scarring, some tearing that occurs during the birthing process, or some pelvic floor muscle tightness. Dr. Val, can
Yeah.
I kick it off to you for a little more chats on other things that can come up?
Yeah, yeah. So with scar tissue, we want to think about if there was a vaginal delivery, that can be any of the tearing that might have occurred, um, second degree, third degree, fourth degree tearing that would have resulted in some stitches. Um, that can lead to some scar tissue, and that scar tissue buildup can provide some tightness in the muscles that are around that area. And so therefore the muscles in the tissues around that area in the opening of the vagina, and so therefore that can cause some pain, right? And then also if there was a cesarean delivery, then there can also be scar restrictions there due to the surgical cut. And then with that, again, you're having some imbalances in the way that your core muscles are working. And
Mm-hmm.
therefore, there's such a strong, if you've been with us by now, you know, we're going to talk about that strong core muscle, pelvic floor muscle relationship. And so,
Yes.
any imbalance in the core muscle activation is going to affect the pelvic floor as well. And so, if anything you're taking away from this today, think there could be some scarring there. There can be some either
Dryness.
scarring in some dryness there, and those things can affect my pelvic floor muscles and the tissues around the vulva, which is the outside, as Dr. Saiah was saying. And so that can all lead to pain. So those are those physical factors that we wanted to touch on. And then there are also some emotional and nervous system factors. And again, if you've been with us by now, you know we are going to talk about that nervous system because it's so important. It's really, really foundational. And so some of it can be related to some of the pain that you might be experiencing can be related to guarding or fear of pain. So it's this cycle that happens. It's a pure fear pain cycle where an activity that you participate in can result in maybe a pain alarm. And then because your brain is producing that pain alarm and is so focused on making sure that you are safe, your brain starts to say, if you do this, this is painful. If you do this, this is
Mm-hmm.
painful. And therefore, I'm going to tense your muscles up. I'm going to make sure that it's not possible for you to do this activity, right? So guarding from fear of pain can happen. And that guarding can happen within the muscles within the vagina, within the pelvic floor. The thing about that is if you are having penetrative intercourse, penetrative sex, and you're trying to push something into tight muscles, can we all imagine? Can we all imagine how difficult that might be, right? That can also then lead again to that pain alarm happening. So there's a cycle there, right? But all of these things, I do have to say, it is we can address them. It's not something that you can't address. We can address them. So that's one thing. And then Dr. Saiah, do you want to talk a little bit more about kind of the other emotional aspects as well?
Yes, yes, yes. I always like your analogies and the way that you relate things. It's like envision things pushing into the tight muscles. It's like, no, things do not go as far. And it is one comment on that as well for my ladies who might have had some concerns or some issues with pain with sex even prior to being pregnant. in postpartum, it can still be there and it's still a great time to get it addressed because I've seen a couple of mommies where they're like, this was there before. And they were like, I was hoping it would be gone, but it is not gone. I'm like, that's okay. That's okay. Um, and so when we think about, yes, it can be the birthing process and us getting adjusted to the new feeling of the body, but it can also be kind of past tension in the pelvic floor. And it's like can be past trauma, can be past just anything coming up from the past can still present in this postpartum time period. And kind of again with the body mind correlation recreate that tension, recreate that tightness, or even like if the nervous system is overstimulated,
Yes.
that can still present as like a pelvic pain or a pain with sex that kind of lingers even after. And so, oh, it still hurts. Nothing is touching, but it still hurts. Um, and so, yes, we are, or we have been mentioning like pain with penetrative sex, but it is also important to note I'll have some mommies come in where they're like, ooh, even clitoral stimulation or
Mm.
even like any
Yes.
type of stimulation on the outside is also bothersome.
Yes.
That can come up. There is assistance for it. Um, and then one other thing to note is sometimes overstimulation and stress.
Oh
Y'all, I
yeah.
was just telling about the number of moms that I hear who are touched out, where it's
Yes.
like, yes, I'm breastfeeding. Yes, even when you mentioned you have a pet.
Yes.
Yes, I have other children pulling on me. Yes, my partner, my family, my whomever also needs physical touch support. And it's like, I am tired of being touched. And so at a certain point, the body's like, okay, let me
Mhm.
pull back a little bit. I'm getting tense from the overstimulation.
Oh
And
yes.
so yeah. I was like, we do always say the mind body. And it's like, yeah, the body is going to tense up because we're tired and we're stressed. We might need a break, might need a little bit less stimulation.
Absolutely, absolutely. I think about you know I'm here for the analogies. I think about my cat and how if she is over being touched, she'll hunch that little back and draw
Oh,
herself
Bella,
up and kind of
Bella.
be like, I'm done. Yes, shout out to Bella. So it's in the very same similar way, like our bodies will tense up in that way. It's just kind of this nervous system response to feeling overstimulated, feeling stressed. So yes,
Yeah.
absolutely.
And even
Go
when
ahead.
it comes to sorry Dr. Val, even when it comes to like being sexually active, you want to be relaxed, you want to be
Yes.
able to get in the mood. It's
Yeah.
like one of my patients was like, I'm like a car, I gotta be warmed up in the winter.
Yes.
Like I'm trying to turn on, I'm trying to warm up. Like if I'm
Yes.
not warmed up, then it's just not working for me. And I was like, no, and
That's
that's okay. And so like needing the time, the space to be like, okay, I have to warm up for this activity. And
hmm
no, it's not a warm up when you're either doing the dishes, when you're feeding the kids, when you're trying to do 99 chores. That's not a warm up. The car is not getting warmed up.
no.
Um, I had to throw in one analogy. I was like, yes, Dr. Val's the analogy lady. But even
No,
when
I
we talk
love it.
about emotional and physical warm up, it's like
hmm
you need a bit of both.
Absolutely.
Um,
You do. You do. Yeah.
oh,
You were
I
gonna
was
say
gonna
something?
say,
Go ahead.
yeah, I also think about even like when we talk about warming up, getting back into the desire and wanting to
hmm
be active again. Because I was like,
Yeah.
there's the stress of regular life. Then I know some people have mentioned stress when it's like, well, my partner's ready and I'm not ready to get back to normal, which can also slow down the car warm up. There's so many factors that can contribute.
It can. It can. I mean, we have people come to us all the time. I know saying like, I really am not interested in starting back,
Yes.
and
Mm-hmm.
that is something in and of itself, right?
Mm-hmm.
You're gonna know when you are ready, when you are interested in wanting to return, right, to sex, but sometimes with that pressure of wanting to quote unquote get back to normal or wanting to resume that pressure that's coming maybe from a spouse or a partner, that can also lead to some tension in the pelvic floor. You cannot fool the body. The body knows always what you
Mm.
want to do. So, um, definitely making sure that there's some communication there to reduce some anxiety and um, have, if desired, have a slow reintroduction to intimacy is very important. But I love your
And
analogy
to
with the
that,
car. Go ahead.
oh, I was gonna say, and to that point, to the communication and reintroducing intimacy slowly,
Hmm.
like I think everyone can be on their own timeline.
Yes.
What I will also say, pending what that timeline looks like, if we're looking like, and I can't tell you what everyone's normal is, 6 months, 8 months, 12 months, and you're like, I don't know. I don't know if desire is there. I don't know if desire is returning. There are also considerations
Yeah.
for, so yes, pelvic PT, I usually tell people I work in the realm of pain free sex, but there are sex therapists if
Yeah.
this is something you want to pursue. There
Yeah.
are different modes when it's like, I don't know, because sometimes it's the physical, sometimes it's the mental, and no one is to tell you what you must do or must not do. But if you're like, oh, I don't know why, and I would like to explore more, just know there are resources. Like, yes,
Yeah.
medical providers, mental health providers, also in the medical realm.
Yeah.
Like there are resources that are there for you, as well as partners, what have you.
Yes, yes. Good point. Good point. Okay, so then let's talk about what we can do about these things because we've given
Yes.
our why, but what can we do about these things? A lot of it can be addressed sometimes with really gentle breath work and pelvic floor relaxation techniques. So, again, if you've been with us before, you know that in our master classes, we dive into practices like different breath work techniques and pelvic relaxation techniques. But ultimately, it comes down to being able to activate your rest and digest nervous system, your parasympathetic nervous system. Breath work is a really great way to do that. And so we talk about expansion in the ribs, we talk about expansion in the belly. That's also going to lead to expansion in the pelvic floor, making sure that
Yes.
our posture is good. So shoulders are over ribs, are over pelvis. That's going to also help to lengthen with the breath and everything. And then with the pelvic relaxation techniques, there are a lot of different things that we can do. A lot of times we incorporate yoga poses and yoga
Mm-hmm.
moves, such as legs up the wall or happy baby. There are lots of different positions that we can take to actively relax the pelvic floor. And so a lot of times our homework for folks is you're going to give me 30 deep breaths in these positions. And
Yes.
you'd be surprised how much it helps to relax and stretch those muscles and just release the tension from those muscles, I'll say.
Yes, girl, the deep breaths in the different positions. I just had a patient ask me last week, they're like, that's it? Yes, ma'am, that's it. I'm sure that's going to be enough for you to do this week is to relax the body. And so when you said yoga postures, I'm like, absolutely. For my folks who do not do yoga, that is fine. However, some of these stretches or some of the stretches within the yoga practices can be really helpful. I'm like, oh, that's a nice child's pose. Oh, that's a nice cat cow. Can be
Mhm.
really great for opening up that pelvic region, and
And
softening it.
yeah, and with that, to all my folks out there who are like, yoga is just not my thing. Just be mindful that yoga is accessible to all and every body. And so it can look like using props. It can look like
Chair.
modifying, yes, using a chair, using a wall, modifying in different ways, but it yoga is accessible to every person, every body. And so I just want to say that's an option. That's definitely an option.
Yes.
Okay.
I
Um,
like it. I like it.
yeah, and then some other things that we can do, right? So we've talked about breathing, posture, relaxation techniques. There's also some self-massage. And so a lot of times when we're working with clients, sometimes we do actually have to get into the tissues and help to manually stretch them using a pelvic wand or a finger or whatever the case may be
Mm-hmm.
to help to actually get a massage of the tissues. Think of like your really overworked and tired upper trap muscle on the top of your
Mm-hmm.
shoulder. Sometimes those knots just need a little bit of tender loving care as I'm over here massaging my upper trap. But
Yes, Dr.
sometimes
Val.
it needs a little tender loving care with a little bit of pressure, a little bit of massage as well. And so that is something that we would definitely encourage you be instructed to do by a
Yes.
pelvic floor therapist. We coach individuals on doing how to use this tool and how to use this technique, but definitely we would not recommend going at it alone,
Yep.
just
You don't want to be
because
surprised.
you don't want to be surprised. You want to
You
know what you're
don't.
doing down there. So definitely be guided through that process for sure. That's our disclaimer.
What I would also say to that point, I'll even teach when we're talking about, okay, wanting to incorporate partners. I will even instruct partners like, hey, this is how you can do the release. This is how you can be helpful. Is this something? But I usually ask, do you want your partner to assist you? Sometimes the answer is yes. Other times it's no. I think I'm better off doing it myself. I'm like, either answer is just fine. But it is like desensitizing the area when we talk about scarring, even for the cesarean scars, like
Mm-hmm.
sometimes we go through even just how to position so that area is not uncomfortable. So desensitizing and even stretching out belly as well as that pelvic floor and getting the body used to touch and reminding the body that okay, this touch is okay. Like it does not have to equal pain when
Yeah.
this area is being touched.
Mm-hmm.
And a quick note with that, don't forget our um, suggestions for vaginal moisturizers from earlier. If it's the burning or friction, we are not stretching out. Dry vaginal walls. No, no. We want them lubricated.
Yeah.
And if you do need lubricant on top of the moisturizer, so moisturizer, yes, that's its own thing like vaginal lotion. Lubrication, if you are having penetrative intercourse, even on the outside, um, lubricant can also be helpful, especially in those early stages. People will say, I've never used it. I'm like, today might be the day
Might
to use it.
Absolutely. Absolutely. And then we can't forget in our last little bit here, we can't forget to talk about the importance of hydration. Really,
Mm,
honestly, it gets overlooked 90% of the time, but it's one of the
time and
first
again.
things that we ask about in the postpartum period because you've thought so hard about staying hydrated while you're pregnant, and then all of a sudden you have baby and you're busy, you're tired, all these things, and hydration is the first thing to go. That's actually going to be the key factor in helping to bring back moisture into the area.
Yes,
So
ma'am.
definitely consider that hydration. Staying well hydrated is absolutely important. And we also talked about the posture as well, making sure that you were maintaining an upright posture, maintaining a posture that's going to promote some lengthening of those pelvic floor muscles as well.
Yes. And just as a final note, we want to focus on what feels good, what feels pleasurable, just being curious about how the body feels in the new space versus being like I have to be a high performer. This is not a performance, y'all. This is everyday life, getting back into what works for you, what works for your partner, what works even during if you're doing solo play, like what feels good and what feels pleasurable.
Mm,
um and really taking that time, because when it comes to healing and recovery and working back into intimacy and different sorts. Like it's part physical, it's part emotional, and you definitely need to, or it's definitely helpful to give yourself time and to be compassionate with self and communicate that with your partner as well.
Absolutely. So it's all about communication. It's all about listening to your body. And if you have any questions for us, we are more than happy to talk about this. We love to talk about this and more. So stay balanced, mamas, in the meantime. Thanks so much for tuning in.